what is something that you wish more employers knew?
Yeah, the one thing that I wish employers knew about managing their healthcare cost is really trying to not treat your benefits like a 1 year strategy. It's really important to build a multi-year strategy to help manage claims, reduce cost, and improve overall outcomes. Misty Randall, Vice President of Sales for Cigna North Florida for our Select segment, which is the under 500 market. The challenge is that healthcare costs, right, are driven by long-term trends. Pharmacy spend, chronic conditions, high-cost claimants. And those things don't reset with every renewal, right? Those things follow you. So allowing a carrier to have the opportunity to build the runway, to review your data, to identify issues early, to intervene earlier, to help guide the navigation, truly helps to improve the outcome for the member as well as to reduce your claims cost. So when employers make decisions every year, they switch carriers every year, right? It becomes harder to manage cost. Your data from carrier to carrier becomes fragmented. Your solutions within those carriers are also different. Also creates a situation with HR where HR is really managing disruption and not being able to manage cost, help to identify drivers of claims, and really help to implement programs to help reduce and bend that claims curve.
So I think what's impeding that is if I move from one insurance carrier to another, it's not like my employees are taking full advantage of all of that new carrier solutions from day one. There's some time for them to get adapted to what's going on with their new policy,
yes.
Right?
Yeah, it takes time to settle in, right? From your open enrollment to getting people situated with their new provider network, potential PA disruption on specialty medications. All kinds of things can happen when you change carriers, right? We each have our own different little flavor.
Right.
So it's important that you give your program, your long-term strategy, the runway that it needs to start to see the results, the compounding results of the programs that each carriers have in place to help manage costs. Yeah, I really think it comes down to planning. I'm a big plan your work and work your plan person. And when we're aligned, again, when this three legs of the stool are aligned, the carrier, the consultant, and the employer, and we're setting strategic objectives and we're checking in on quarterly or annual or biannual meetings. We can review your claims. We can, again, keep coming back to identifying the drivers of these costs. The sooner we can get our arms around that, the sooner we can mitigate that. And that's why I think it's so important to be able to have access to your data so that you know what's going on and you're not just blindsided by a renewal that's higher than budget, where then your instinct is just, well, I'm just going to market and move carriers year over year. The discipline that you need is the commitment to see the programs work. They compound over time, right? The benefits are not going to be realized in year one. I start working out today, I'm not going to be thinner tomorrow, right?
Oh, shit.
You really need to let some of these solutions sink in order to see the benefits. Chronic conditions aren't cured overnight, right? But to allow your carrier partner, whether it's Cigna, whether it's UHC, whether it's any of the big players out there, allowing those solutions that are embedded inside those carrier programs truly does help to bend the claims curve. I had a boss that one time told me you can't manage what you can't measure.
Yeah.
And so in order for an employer, a broker, a carrier, again, this partnership, in order for us to manage the partnership and the spend better, we have to have better access to the data. We have to see the trends that are coming through. And like I said, those trends don't happen just in 1 year, right? They're things that follow the customer year over year over year. So allowing the carrier the runway to build a program, a sustainable program to help stabilize the population and stabilize the claims volatility really helps to improve, again, cost over time as well as outcomes.
Because really in the select segment that you and your team work in, otherwise you've basically just have 6 months worth of data by the time you even get to the first renewal with a new carrier, right?
Right. Not enough data to develop trends, not enough data to identify ways that we can really help to bend that curve.